welcome to Medical Dialogues. We have with us today Dr. Dinesh Verma, who is a distinguished British Indian ophthalmologist with over 4 decades of global experience. He has held prominent roles including Consultant Ophthalmologist in England and the Chief of Retina Service at Hull and East Yorkshire NHS Trust. Dr. Verma has published extensively focusing on cutting-edge technologies such as virtual reality stimulation, retinal chip implants and AI in diabetic retinopathy screening. His notable inventions like the Personal Ophthalmic Diagnostic System have won prestigious awards including the NHS East Innovation Award and accolades from the Eureka competition by Bombay IIT. So heartiest congratulations Dr. Dinesh on being a recipient of the award, and Medical Dialogues basically aims to highlight and promote young such researchers as yours, and heartiest congratulations once again.
Thank you very much. It has been a real honor and it's nice to be here in India. I do spend almost 6 months in India, still carrying out research. Rest of the time is either Scotland or America. So it is great to be here. Thank you.
Great. So Dr. Verma, if you could just give out any message to the young researchers who want to get into research and any message that you would want to highlight on.
So I would say have the mindset of a researcher. Most of the times what happens is when we are training as doctors, we are taught things about medicine as such, how to treat patients, how to learn about what has already been done. Very few people think about what can be done which is not done now. So that is the mindset of the research, and once you start thinking in those lines you will get so many ideas. And also the second thing I would say is interact with other fields. We get very narrow-minded. That was one of the major differences that I discovered between Indian training and training in the UK and in America. In the US, there is so much interaction with other specialities within medicine and outside medicine. And there is also a tradition of dual degrees. So people who are interested in technology, they would do an engineering degree and also do a medical degree. And these are the best researchers because they have knowledge of both sides. So I think that is something, the message that I would really want to give.
Great. And so lastly, if you could just want to highlight anything about your research for which you are being appreciated by Medical Dialogues BlackBuck Awards.
Yes, so I have been involved in artificial intelligence, which is now known as augmented reality, augmented intelligence, from very early stages of my career. So we were one of the first ones to develop a virtual reality simulator for a special type of eye surgery called the vitreoretinal surgery. And we published that in the Nature publication Eye, and that had elements of artificial intelligence whereby a person can be trained on the simulator before they go into the eye. And then I was lucky enough to go to Johns Hopkins University hospitals, where we developed further features to the virtual reality simulator. And I was very lucky to be working at Doheny Eye Institute. We started the new Doheny Retina Institute, and that's where I worked on artificial intelligence. One of my projects there was to monitor the changes in the retina of diabetes. So that's a condition called diabetic retinopathy, and for that one had to look at retinal photographs or patients' eyes, and probably about 80% would be having no retinopathy, but it has to be seen, and the ophthalmologists didn't have much time because they're busy with surgery and so many other things. So I wrote an algorithm with my team of software engineers whereby we just put in a questionnaire where people coming out of school, they have no training, no medical training. All they have to do is to say, I can see yellow spots here, I can see red spots here in a retinal photograph. and the algorithm converted that into a classification of diabetic retinopathy, international classification. And we did a trial comparing it with ophthalmologists and with the machine. And this is in year 2003. So,
Way back.
yes, and we got a 94% concurrence, which means the algorithm was right 94% of the time.
That's actually a very high accuracy.
Absolutely, but since then things have moved on way ahead. And now we are developing a device which is, as you mentioned in your introduction, the Personal Ophthalmic Diagnostic System. So I've been involved in that for almost 15 years now. And we now have reached a stage where the artificial intelligence will be used to analyze the images and give a first report to say whether you're absolutely fine, come back for screening in 6 months, or you need to see an ophthalmologist but as a routine, or you need to see somebody urgently. So at least that 3 level, but we hope that we would actually be able to diagnose many more conditions using the artificial intelligence and machine learning.
Great. So, heartiest congratulations once again on being a recipient, and definitely your research has to go a long way because that's the next generation and that's how it's going to get integrated into medical healthcare. So, thank you so much for joining us at Medical Dialogue.
Welcome. Thank you very much. Thank you.